We're going to be going live here with the conversation in just a couple of minutes, waiting for a few more people to join, and we'll start off in just about a minute. Okay, welcome everybody. I'm Neil Chase, the CEO at Cal Matters, working like everybody else from home today. And I want to thank you all for jumping on with us. We've had, as everyone has, an unusual and incredible series of days and weeks here. Our staff is working 24/7, doing a lot more work than we have in the past. And I think I know a lot of people are in similar situations, and some people are in some very difficult situations. And so we're doing everything we can to help, trying to share all the information that we get as soon as we get it, and help people make some sense of this, answering some questions. This is the first in a series of these online conversations we're going to have, asking some folks who can help answer your questions to join us and share what they know. We did a story a couple days ago on the plight of senior citizens who were trying to figure out how to get through this crisis, and that led to hundreds of questions from readers, which is why we put this event together today. If you have questions while this is going, there's a chat box on YouTube and a chat box on our website if you're watching it there. You can put your questions in there. We will get to as many as we possibly can. Want to introduce our guest. Kim McCoy Wade is the director of the California State Department of Aging, and also has been tremendously busy in recent days trying to figure out the state response to this. So Kim, thank you for joining us.
Thank you, Neil. Thank you, Cal Matters.
Glad you're here. And with us are two of our journalists who've been on the story since day one. Ana Ibarra, who covers healthcare policy for us, and Judy Lin, our assistant editor, who's got a deep background in covering the economics and the economic policy of California. So at this point, I'm going to turn it over to Judy and Ana and let them take it away.
Yeah. Well, thank you. Thanks for being with us. 2 weeks ago, you were going to Disneyland. You were going out to basketball games, and today we're all at home, and school is closed probably for the rest of the school year and through until summer at the minimum. Restaurants and bars bars are closed, and restaurants are doing some takeout if possible. The governor issued an executive order that directs seniors to stay home, and other parts of the state in the Bay Area, and just today in Sacramento County, are ordering all people to shelter in place. And so we want to sort through some of that with you and how that's going to affect us, particularly for those 65 and older.
So I am just going to give a quick overview as trying to answer, why seniors and why this guidance for seniors and people with underlying health conditions to stay home. So while a lot of this is still new, health officials have identified that older people, particularly 65 and over, as well as people with compromised immune systems and certain chronic conditions, are at higher risk, and not necessarily at higher risk of contracting the virus, but of getting sick from the virus and showing more severe symptoms. And this is a big deal in California because 1 in 5 Californians is 60 and over. So we do have some questions, and just to share a little bit of global data, we do know that the overall mortality rate for COVID-19 right now is pretty low. The World Health Organization has it at 1.4%, but this rate increases for certain groups. So in China, for example, the majority of the cases that resulted in death were of seniors, and so the death rate there for people ages 80 and over was at 21.9%, so significantly higher for those groups. So I wanted to start, like we said on Sunday when we wrote about this, we received a lot of questions from people, from readers. And so maybe Kim can help us answer some of these. So one of the most common questions we received was, what exactly does self-isolation mean? People want to know if they can go to the grocery store, if they can go out for a walk. So maybe we can start there, Kim.
Absolutely. And thank you again. One of the most important things we can do is be communicating frequently and in all kinds of channels. This is a very serious situation and it's a very fluid situation. So I'm really glad for this opportunity to dialogue with you and your readers or listeners today. So yes, what does it mean to be isolating at home? What does it mean to be remaining at home? And to answer your first two questions, can I go to the grocery store? Can I walk? The short answer is yes, but it's not that simple. Let's talk about it. In general, yes, if you are higher risk, you should be staying at home as much as possible. And those of us in the Bay Area and Sacramento, all of us should be staying at home. We're all in this together. The exception, of course, is for essential activities, which includes food, which includes medicine, which includes exercise. Those are essential activities. But here's where the work really is. Can you get that essential service and still stay at home? So what we're all about right now is moving services to the telephone, to the internet, by mail, by neighbors. Let me get real concrete. So can you do your medical appointment over the phone with your doctor? Can you have your groceries delivered? Can your lunch that you used to eat at the senior center now be delivered or be pick up to go by a neighbor? Can you get your prescription in the mail? That's the work we all need to be doing, is moving as much of our essential services. And I want to be clear, internet's not going to work for everybody. Internet's not going to take care of every service. So the other thing we really need all of us to do is know your five. Who are your five people? Your friend, your family, your neighbor, the person you don't know yet, who's going to be one of your five, who you're going to offer help and who you could reach out for help. We're all going to be in both of those boats. And so really lining up people who can pick up those groceries, who can pick up that prescription and do that. Now, if you have tried all those things to think about other ways and got help to get that essential, then you're going to need to go out to get your food or to get that critical medical appointment. And that's when those common sense precautions come in. One, the physical distancing, right? We've all heard this now, stay several feet away. And two, the personal protections about hand washing, not touching surfaces, covering your cough, all of those issues. But that's the last step after you have really tried to minimize anything but essential travel, and then try to invent these new ways of being, which again is a particular challenge for some of us who are older to move all these things to telephone and online.
Kim, are there times of days when you would advise people to get those things done?
This is a live question right now, as many grocery stores are moving to that first hour. And the idea being that hopefully it would be less crowded, so physical distancing, and it would be cleaner and more sanitary. I think we're all really looking at that from a public health perspective. It's not as good as staying at home. It's not as good as staying at home, but people need to eat. And so I think we're all, as a state, as communities, as families, as neighbors, we're trying to make those decisions every day.
And Kim, you talked about food delivery and delivery for medication. Is the state doing anything to help out with that? Where do we stand on that?
Yeah, so there are existing programs that do meal service, of course, whether it's your food bank or you might have heard of Meals on Wheels or senior centers, and all of our programs are moving to issue as much flexibility as possible. The feds have been great partners. We have been working overtime. I should have mentioned from the beginning, you can get general information, of course, at a brand new state website, covid19.ca.gov, but there's also a website that has specific provider information. So whatever senior program you're running or disability program you're running, home care program, almost daily, new flexibilities are coming out. In my department, we partner with local adult day centers, where a lot of folks who live at home as they age go during the day for socialization and nutrition and physical therapy. And those centers are moving as fast as they can to convert those services to telephonic. So that's a whole new flexibility. It's a whole new different way of delivering service. There'll probably still have to be some home visits for people with particular severe health needs. So working all that out is requiring just significant flexibility at the federal, state, and local level. And we're all working very hard and very quickly to make that happen so the services continue even amidst this public health situation.
And Kim, the governor, he's been great about offering daily updates. And in one of them, I recall, he said he would provide, or the state would be providing more guidance for seniors, or whether it's through the agency. Do you have an expectation on when that more details might come out?
Well, I think there's a couple ways to answer that. So again, program details are coming out all the time. Our largest program as a state is the in-home supportive services, IHSS program, and guidance came out recently on that. We've put out multiple guidance to our food program providers. So guidance continues to roll. I think coming up a level, we're really working not just to change the current programs, but to change the current environment for all of us who are going to be isolating at home. So communication is huge, more information, and not just on the internet. Many of us don't have access to the internet reliably, so in all channels. We're also really looking at check-ins. Check-ins are going to be incredibly important, that we're all checking in. And again, not just the current programs and government staff, but neighbor to neighbor. How are we checking in with each other? How are we making sure food and other basic needs are being met? And then check-in is only the first step. The second step is connecting to that resources. If you do check in and someone does need help, whether that's food or a ride to the doctor or something, right now, the best answer is, of course, call the line you would always call in your community. Call your 211 or your county social services or your food bank. And we're working very closely with them to try to expand the capacity. Of course, more calls are coming in, more requests for help is coming in. And so that's what we're doing, is both changing the system to meet this new public health reality, and then expanding the system to meet anticipated new needs over the next weeks and months, as you indicated earlier.
And so a lot of the questions we received were from seniors who still work. So I know the guidance itself did make some exemptions for healthcare workers, so which is significant, right? Because we know that like a third of our state's physicians are 60 and over, so we need them. But what about people who work, for example, like at a grocery store? Those are still open and people need their wages. So what is kind of the recommendation for those people who still have to go out and work, but they're, seniors?
This is, again, this risk decision tree that we're all going to be on. It's best if we can all stay home. But as you said, there are essential services to be provided and there are economic needs. And so we are urging people to stay home if they can at all. If you're an essential service, that's a different determination than if your work is not. And again, many of us can telework. Look at us all here. Some jobs don't lend themselves to that. So that's a challenge. And that we're trying to respond to that with aggressive support for unemployment, for paid family leave, for other economic supports. You see the extension of CalFresh reporting deadlines. You see lots of things trying to bolster the economic side so that people aren't forced into those terrible choices between their economic health and their physical health. And we are urging people to put their physical health first and foremost, but don't want to minimize at all what that means for people jeopardizing income that they need for basic needs. You see it also in the protections, the governor's direction to try to protect against evictions and just try to slow that, recognizing people's incomes are really going to be falling. We were hearing from other elders yesterday who were talking, reminding us that if they're home all the time, their utility bills are going to go up. So there's more for us to think about what it means to be at home more with either fixed income or less income coming in. It's quite serious.
And Kim, I don't know if you would have an answer for this, but one of the questions we did receive that I thought was interesting was on the note of jobs. There are nurses who are still on the job at 65 and older. And one of the questions we received was can they refuse, given the they're being in a high risk group, can they refuse to treat a patient or COVID-19 patients? I know from my reporting, there were some hospitals where nurses said that they they had some sort of volunteer list so that, they would kind of protect some of the workers who may be in these high-risk groups, or maybe go home to people who are in this high-risk group. So they had kind of a volunteer list going. But I'm wondering if we know if there's any sort of, permission that allows nurses who are in a high-risk group to, refuse to treat a COVID-19 patient.
I think your reporting is spot on, that people are making these decisions and determinations and setting up systems and triaging as we speak, that those kinds of needs between workforce and service provided are playing out in real time. And so that's where we are. And I think, the state's trying to provide flexibility in regulation as well as clarity in public health guidance. And of course, there's state public health and local public health guidance, as well as, of course, our CDC colleagues. So that's one of many difficult decisions that's being worked through by healthcare systems, by healthcare professionals, by families.
And Kim, I want to move back into the House, whether it's the affordable housing crisis or for whatever reason, families having multiple generations in the house. For those seniors who are living in that situation, in that dynamic with younger kids, what sort of guidance would you provide for them? Do you quarantine grandma here? I mean, or is it okay to be together?
The public health guidance really is to isolate people at risk, whether it's the underlying health condition or older adults, even within the home. That is the guidance. And children do, best we can tell from the science, that children do present a risk to other people who are higher risk. And so that is the public health guidance. And I know families all across the state are struggling to make sense of that and to put it into practical practice. And so, yes, ideally, yes. If your housing allows it, the healthcare, the health status of everybody allows it. But again, people are going to have to, can you completely limit contact? Is it essential that you have some contact? Then make double sure that you are practicing all those public health precautions, that the hand washing, the surfaces, the coughing, which can be hard for little kids, right? But this is really a time to, the best thing you can do for your grandparents is to give them a call, is to help them set up FaceTime and Skype if you have those resources. We're going to, just like the schools are going to be closed for weeks and months, we're going to be in this for weeks and months is our best prediction right now. So take the time to set up that home delivery of grocery, that mail prescription, that Skype account, get set up for a lot more independent living at home, but we hope deeply, deeply connected and supported living at home.
And, as we brace for that self-isolation, there are emotional things that come up. I mean, there could be the blues, there could be depression, there could be a lot more mental anxieties associated with it. So do you have any advice for coping for seniors?
Yes, and I actually would welcome people who are watching on YouTube to add their suggestions too, because every time I listen to other folks, they have got great ideas. So again, get your list of 5, make sure you talk to them, chat them, call them, whatever it is, at least every day, so that you are having that. I just texted my parents a picture of their grandchildren myself. So do that every single day, at least. But I think we were talking to some community groups who are not just delivering food, they're going to be delivering craft projects with that food. I know there are national hotlines, whether it's Alzheimer's, folks with dementia may be experiencing a particular anxiety, which is particularly challenging for families and caregivers to manage. Call the National Alzheimer's Hotline for support. So I think those are the kind of resources we're trying to gather, the grassroots to the hotline, family to people you don't know. We're hoping that all those, I talked to a pastor who was calling every single person in his directory to see how they were doing and match them with someone else in the directory. I think you're going to see all kinds of initiatives like that. Lots of people have been wondering if all the college students who are now home and tele-learning would be willing and able to step up in new ways and partner and be part of these neighbor-to-neighbor teams. So I think we're all, and I've been in contact with technology companies who want to help us build these nimble platforms to make those matches. And of course, we got to be safe doing that too, right? But we want to make, the point is we all need to get connected, and we need to get connected to new people, and we need to get connected in new ways to our current people, and just commit to that daily interaction. If you've got folks in your life, there's who will watch the dance class being taught by Debbie Allen on YouTube, that's great. But we've got to kind of keep thinking. I'm trying to convince someone in my life to get her book club to be on Zoom. We're going to really have to be mindful of all those things, and especially for folks, some of those things may seem more plausible for 60 and 70 than 80, 90, and 100. So we've got to be really thinking about the whole span of old age. Old age is not one age. Old age is many ages. And of course, broadband and technology, we still have a huge digital gap. So don't want to be naive about those solutions. They will work for some, but we're going to have to be more creative and collaborative to make sure we reach all Californians.
And for those of you joining us, you're watching our special conversation with Kim, and I wanted to let people know that they can find out more at calmatters.org/coronavirus. And I think Ana and I are going to try to field some questions now. We've got one from Carol who's asking, is playing string quartets with known healthy friends a risk? Music boosts the immune system, and so social isolation reduces it.
So again, remember our public health guidance. So all gatherings are being prohibited. If they are essential, you need to practice the physical distancing and you need to practice the personal protections. So just the fact that your friends are not feeling symptomatic is not enough to protect you from being safe. I would consider trying Zoom, your quartet on Zoom. I don't know how the sound quality would be, but I would challenge you on that. And then if you need to do it, think carefully about the risks and at a bare minimum, physical distancing and personal protection.
And we have a question from Emily. She asks, what resources are available for senior citizens that do not have any family or friends to pick up groceries for them?
I'm so glad you brought this up. We more seniors live alone than ever before, and which may be helpful from a public health perspective that they already are living on their own, but is certainly challenging in this kind of situation. So there are a number of strategies. One, if they are buying groceries, move to a grocery system like Safeway or others that I'm aware of in my Bay Area, or Amazon. Grocery delivery. I think the other thing is, can you find anybody you know? I've been really moved by the outpouring of support. There are volunteers coming in. I will say it's a challenging time for our food network because older people have always been the backbone of the volunteers at food networks. So it's been challenging for food banks and Meals on Wheels as those volunteers have had to withdraw to protect their own health. And now new volunteers are coming forward and need to get screened, trained, et cetera. But I do think, calling your Meals on Wheels provider, calling your local 211, if you need grocery delivery or meal delivery, try to connect with your charitable and social service networks. Takeout food is still open. DoorDash and Uber are still open. I mean, there are ways to get food that we are trying to get clearer and promote about, depending on where you live. Rural's going to have harder with this. And of course, depending on resources. But trying telephone, trying technology, and trying to ask someone who you might not have asked a week ago. But we are in a different world, and we all need to be reaching out to offer help and to ask for help.
Another question from Rocio. My mom is 67, Spanish speaking only, and on Medicare. She recently displayed symptoms of a cold, as in runny nose and a headache. At what point should she or other seniors seek medical attention?
Well, I wouldn't hesitate to reach out to your doctor by telephone, or if you have the telemedicine, the electronic records, by email, some of us may have. I think it's absolutely appropriate. Don't go in. Don't go in until you talk to them, unless, of course, it's an emergency situation. An emergency trumps you. Then, of course, you would do a 911 or an ER situation. But if you have a question about your health status and you are at risk, absolutely the perfect time to reach out to your doctor.
And on that, just to add on to that, or to we have heard and we know about the troubles and the challenges with testing, right? So if someone who is a senior and is showing some symptoms, would they qualify to get tested, or would they have to wait? Do we know?
That is a situation that is changing hour by hour as more testing comes online from a variety of sources. You really do have to talk to your doctor and your local public health to see. We're all trying to get more testing for more people yesterday. So I don't have the answer to that, but there's no reason not to ask and see what the protocol is.
Gotcha. And we do have a question from Maureen. She asks, I am 76 and in basically good health. I have heard that type A blood type has a greater incidence of infection. Is that true?
You know, that is not something I've heard, but I am not a doctor or a scientist. So I would check with CDC or World Health Organization to get the definitive answer on that.
Okay. Barbara asks, main question, not just for me, how can we file federal taxes if we can't pick up forms from closed libraries? Many seniors don't have printers. I understand we still have to file by April 15th.
That's a great question. I have, as you know, the governor has postponed the date for the state taxes. So state taxes are, I believe it's June 15th. I'm looking through all the
July.
July. Thank you. Great. Thank you, team. July 15th. So don't worry about your state taxes. I'm hopeful that federal taxes will follow, although we have not. Again, I'll ask the team here, the policy experts. I haven't seen that happen yet. Have you seen it?
You know what? I don't
think so either.
I don't think so either.
So you're right. But honestly, I wouldn't worry about it at this moment. It's not worth risking your health about. Let's put it that way. Let's think about what else you could do. You could ask a friend with a printer if you were committed to doing it. If you're looking for something to do this week, I'd be remiss if I didn't say do your census. Do your census. Census should have come this week. Focus on the census. Get counted. We need to be counted for all the federal help and state help that this is going to require. And I would expect more information to be coming from the IRS on taxes very soon as they either affirm or postpone the April 15th deadline. Again, I don't want to get ahead of anybody, but we're hopeful they'll follow our state lead and postpone. And then again, I would not put that in an essential service that's worth risking your health over. We got to figure out other ways. Maybe someone could call you on the phone and walk you through doing it online. We could get creative about other ways to meet those requirements. But again, let's hope that one is going to shift soon.
And do you want to take it? Go ahead.
Oh, I was just going to follow up with the next question. They ask, what about protections over food delivered being free of contamination by preparers?
Yes, I mean, those concerns are always there when you order home delivered food. You're trusting that the place is observing the public health guidance. And so that is still true here. Restaurants are an important part of our food system. We need to keep our food system, whether it's grocery, food banks, and delivery meals open. So yes, but it's a calculated risk, I would say.
And something that we're now hearing about more are people getting scammed or cons. This is a time when people are scared and there are people out there who will take advantage. And so we've got a couple of questions on this topic about how are we warning people about scams and or even overpaying for toilet paper on the internet. And how do you, what's your advice?
Well, again, I think it's finding your trusted sources of information. And so the government, California, we're trying very hard to have covid19.ca.gov be a trusted source of information. We recognize the internet does not work for everybody. So we're working to stand up a state helpline as quickly as possible in coming days. That will be a telephone line where you can always get information or validate information. It is a big concern. It is a big concern. People are going to be unfortunately taking advantage of the situation, and we do need to make sure that you're connected. I mean, again, that's part of identifying your trusted source of information, your local public health, your state public health, and your trusted people. Who are your people in your family, your friends, your neighbors? And I say family in the broadest sense, your family of choice, your tribe, your people, who you can trust for that information, trust for that care. That's really what we're all going to have to be doing is relying on trust and really building that trust.
And Kim,
and of course there are the government is our governor and our local partners are being very aggressive about price gouging, and those types of things are being enforced. So there is that side of the house as well.
Kim, I just wanted to follow up because you mentioned a helpline, and earlier you mentioned the new COVID-19 state website. The helpline and the site, do they have information in other languages for people? Because we are getting questions.
Yes, coming very soon. Absolutely. We are working to particularly Spanish, but also traditional Chinese. And then I've been very impressed as usual with local county public health departments have great information. San Francisco, I've seen in Arabic, Vietnamese, Filipino, more languages. At Los Angeles, very similar. So we at the state are trying to represent the diversity of California and get more information out. And so, yes, top priority, more to come.
We have Janice, who's 71. She's asking just to clarify, in terms of what can we do to stay fit and healthy? Can I ride my bicycle as long as I'm alone? Or, and I'm imagining other people may have other outlets, whether it's running, just
yes,
playing with a ball, kicking a ball around. And so perhaps there are things you can do.
Absolutely. It's the same test, right? Stay at home unless it's an essential activity. I think many of us are clear that exercise is going to be incredibly essential to our physical and mental health over the next few weeks and months. Again, the key is that physical distancing and the personal precautions. So some of our parks around the state parks and our East Bay parks here in the Bay Area, campgrounds are closed, facilities are closed, trails are open. And so, of course, there'll probably be some new trail etiquette working out as you come upon someone to make sure you maintain that physical distancing. But absolutely, please take walks, please go on bike rides, please take care of yourself, but do so in a way that protects against transmission.
Kathy is asking, are there guidelines for family caregivers to participate in the care of their relatives who are in facilities or in hospitals, especially when the relative has dementia?
That is a tremendous question. And you're making me think it's probably not in all one place, which is could be better for our family caregivers. So you actually, you asked many questions there in one, because these are so many complex issues and they're all related when you're taking care of a person in a family. So nursing homes are in a different category. Nursing homes visitors have been banned nationwide. Except for the most end-of-life situations. So nursing homes have a different protocol right now. Other residential facilities, assisted living is not yet there, but of course different, you can check the website or call. They are updating their guidance all the time in response to new public health guidance and new licensing guidance. And then home and community-based, I mean, this is where I really have heard so many families struggling, because they know that the home care they provide, again, an adult to an adult, and often one older adult, younger older adult to an older adult, requires, of course, personal contact and physical contact. And so families and caregivers are weighing, how do I provide that care that I know my loved one needs, and do so in the safest way possible. And that's the rub. You do the best you can to minimize contact and to have any contact be essential and have any contact be safe. But many of us know that the care we provide for our loved ones is essential to keep them healthy and safe. So you're really balancing those risks in very, very difficult times and very difficult situations.
We've got one question about having a family member. I have a family member, a 70-year-old, doing what's deemed essential service. And if they stay home, they must use their sick days. Is that legal? Can they stay home without repercussions because they're older?
Right. Certainly, the governor is encouraging all employers here at the state. Our state employees were just sent home yesterday. I mean, employment is shifting all over, location by location, employer by employer, public employer, private employer, large employer, small business. So it's really case by case depending, but certainly the direction from the administration is these are unprecedented times. Flexibility is needed. Unemployment insurance is now available much faster. Paid family leave is available much faster. So those tools are available. But yes, every workplace is wrestling with these exact issues.
And on that note, I just wanted to add too that I've heard from employers as well, kind of juggling these recommendations, but also not trying to be ageist, and telling some of the employers
absolutely
home. There is apparently some, concern about that. I mean, should employers is that something employers should be concerned about? I mean, I don't know if there would be any legal repercussions or, if you're, laying off or excusing your older workers.
Well, again, we are very concerned about ageism and age overreaction by age. We have heard some stories of people being out grocery shopping and people saying they shouldn't be here, and that's not appropriate. That is not acceptable. All of us are in this together. Be practicing these public health directives. Again, I know they're different across the state, but at least in the Bay Area and Sacramento, we're all supposed to be staying home as much as possible. We're all supposed to be practicing physical distancing and the public health personal precautions. So really, it is really about the each of us doing what's best for our community, doing what's best for our health, and staying away as much as possible. And we each, there are young people who have heightened risk that is not visible, right? And there are people who don't have that much risk because of their health condition and they're closer to 60 than to 100. So I really know this cannot turn into, just as we can't stereotype certain racial or ethnic or language groups, we should not be stereotyping certain ages. We should all be taking care of each other by staying home as much as possible.
Kim, I wanted to flesh that out a bit. You mentioned state workers, and I'm wondering, can you provide an update on which departments, essential or non-essential, are being sent home as far as the state at this point?
My understanding, and again, I would want is that because I've been out remote for a while, is that it is now all but essential are at home.
Okay. What does in terms of the state? Who's deemed essential?
Yeah. At least in Sacramento, we can share that with you. There's there's guidance about a bunch. It's everything from obviously the frontline health, but also managing all these programs, right? Administering all these programs, providing the flexibilities, providing the guidance. Answering info lines, answering crisis lines, and of course the governor's executive order recently about more state staff being on the front lines for residential facilities, right? That's one of our most important areas. So really making sure the state staff is both protected as a public health matter, but fully deployed, fully at the ready for the emerging state needs.
And I'm going to follow up with a question from Nora, who asks, what can elected officials be doing to get the critical word out to seniors?
We just had a great conversation with legislative leadership yesterday about this. I think the first thing is this communication. Communicate with people. And I think it's really helpful not to say shelter in place. It's really helpful not to say lockdown, right? It's remain at home. Stay at home as much as you can. And to remind people that there are exceptions for essential, even while we're pushing people to really think about what's essential and are there different ways to get essential. So kind of getting people ready. And I really appreciated the governor letting people know a couple days ago that school's probably out for a while. And I want the same message to go out to people without young children who have older adults who are older adults. we're probably here for quite a while. So your thinking and your planning should not be the next few days, although I know that's what we're all focused on, but should start to think about the next few weeks and the next few months, and what will you need and the people in your life need to practice staying at home over the coming weeks. So I think that communication piece is really important. We do need help to stand up these services in new and different ways. All the changes. I just saw Senator Harris proposing a bill today that the food stamp program in California, CalFresh, can be deployed in disasters. We've done that many times in California for wildfires and earthquakes. It usually requires face-to-face enrollment. So she has a bill in Congress to change disaster CalFresh, and that would be nationwide, to do telephonic enrollment and online enrollment and other things for disasters, so we can get more food assistance to people. Hopefully, online shopping and online delivery as well of that. So I think there's policy fixes, there's communication fixes, there's support for our providers as they change services. And I think we're going to all be coming together in new and different ways. And it really is truly a partnership. And of course, I'd be remiss if I didn't speak to the enormous speed and partnership the legislature and governor displayed earlier this week in passing $1 billion for immediate urgent needs for hospitals, for homelessness. And so it's that kind of common urgency that's going to get us through this.
A couple of questions are coming in about ride shares, Lyft and Uber and the like. And Beeve is asking, what do seniors do who are being told by a doctor to come in and be seen and they don't drive? Lyft and Uber are refusing to pick up seniors who are ill.
Well, that's the first I've heard of that. I'd like to hear more about
I haven't heard that either. But
I would like to hear more about that for sure, either offline or so. Yes, if this is again, some of this is a challenge of our society. You know, as we were working on the master plan for aging, that more and more of our Californians aren't driving anymore, and so mobility is a real issue. And making sure there are transit options, not just the paratransit, but transit that works. And now in this environment where transit is the definition of communal, we really do need these last mile solutions like the rideshare companies. I hope that they continue to be an option for essential services. Again, if you can't do telehealth, if you have to get there, use all the sanitation practices and the physical distancing. But I think they are one part of our network that we are going to be relying on in coming weeks, are these services.
And Kim, since you mentioned right now the master plan on aging, I'm wondering if you think we're learning anything from what's going on right now in this situation that would, that could impact kind of the thought process and in coming up with this master plan on aging.
Oh, yes. Yes. We've been working on the master plan since last June, and actually the stakeholders have a very, very close to final report that's been released, their draft report of how we can improve how we take care of seniors as we age, all of us as we age, at home, in the community, and residential settings. So obviously it wasn't written with a pandemic in mind, but some of the clear needs that we all need: information about how to navigate the system. We all need enough services to access. We need to be able to afford them. The workforce has to be supported, and state and local government have to coordinate. I mean, those 5 truths are being the ultimate stress test right now. And so we are both experiencing some of those gaps, but we also are the better for having been diagnosing and talking about and working on those gaps so that we can move more quickly to figure out the information system that leverages what's best in our communities in our state and knits that together to a new level. And that we have all the different, for example, if you're living at home right now, you might be getting an in-home care worker. You might be going for a few hours a week to come in and maybe do some cooking or some cleaning or some bathing. You might be going to an adult day center 2 or 3 days a week for meals and fellowship and physical therapy. And you might be getting Meals on Wheels a couple times a week. And so we have a much clearer person-centered view of that person and can start to plan for what their life looks like this week when everything is changing and it's really confusing and frankly frightening, I think, at this moment. And what will it look like in 2 weeks and what will it look like in 2 months? And that is really helpful in thinking about all the community partnerships we need. Frankly, we need some real private sector help and local and state government to really keep that person safe, healthy, connected in new ways in the short, medium, and long term. So both and. I think the planning work is informing our response right now, and I am confident that the response is going to inform the plan.
Kim, I do want to touch back on CalFresh and other food programs. Because there is anxiety. Can you talk about will we run out of food in California? Or, I mean, how's our supply chain for food here?
At this point, there's no sign of food supply issues. That's not the issue. It really is this last mile issue of food from the grocery store or food from the food bank. And then, of course, for those of our folks who need help with cooking, how are they getting that help? Can we get, grocery stores make prepared food now. Can prepared food be delivered? And can we do that last mile? So we're much more focused on the last mile and leveraging private, public, charity together on that. And, of course, all the task force at the governor's State Operations Center have been activated, and food supply is one of the issues. But that is that, and of course, monitoring on that, like we are all systems, but not a concern at this moment as we speak.
And then, Kim, you've mentioned telehealth several times, and we also, doctors and hospitals and clinics that we've talked to for our reporting have also mentioned the importance of telehealth. But there are a lot of services out there, and so wondering if a lot of people might not know about these. I'm wondering if you have any recommendations or suggestions on apps that people should be using. Are they safe to use? What's out there for seniors right now in terms of apps? And
well, I would look at your health plan and look at your doctor, right? I mean, so what they're using, because of course you want it to be secure if you're actually talking to your doctor and those kinds of things. But that's a great idea. If our state health department or local public health departments could suggest trusted sites for that weren't tied to your own medical information, but there might be some resources we could provide to people. I can take that back as well. But in terms of your own individual healthcare, obviously your provider is going to have their own system and network that you'd be looped into.
A quick one, I think it's pretty easy, but is teeth cleaning an essential service?
Well, in general, you should be postponing all routine care. Again, in the general rule of stay at home. But talk to your dentist. Obviously, dental care is an essential service, and a postponement case by case may not be in your best. Again, talk to your provider about whether that's the right thing to do. Mine called me and told me it was, so I did and postponed it. But that really will depend on your particular dental and health situation.
And I did want to ask about, when we have outbreaks or in this time of pandemic, there can be a lot of misinformation out there. And so we just want to see if you can, we can go over and clarify that there is currently no vaccine or no treatment for COVID-19. Somebody asked earlier if they would be, that they had pneumonia vaccines and that if that would protect them against coronavirus.
Right. So no, unfortunately, there is no vaccine. The flu vaccine does not cross over. But that's why we're all staying at home, right? We're staying at home for a couple of reasons. We're staying at home so it doesn't spread as quickly to each other and to ourselves, and to buy time. To buy time both for the testing, to buy time for our doctors and healthcare facilities to be able to treat us over a longer period of time, and maybe, just maybe, buy time for a vaccine. So that's what we're all doing by following these directions, which are undoubtedly life-changing and stressful and hard. But it really is about life-saving and trying to buy some time as we face this.
I think we've fielded a lot, and so we really appreciate your time, Kim. Um, I want to touch on some of the key points that she offered: to remain at home, cancel non-essential travel appointments, uh, non-essential medical care, but obviously check with your doctor to see if you need to go in. Um, uh, if you are in need, call your healthcare provider, and obviously, if there is an emergency, to call 911. Kim, are there any other last thoughts before?
Well, I'm just going to say again, stay connected, stay connected, stay connected, stay connected. The official public health term is social isolation, and it just, I don't like it. I know they mean physical isolation, and we have to do it, and we have to follow our public health direction, but it is now, Dr. Ross at the California Endowment has been very clear on this about how we can't let ourselves become isolated as we're isolating. We have to be in this together. So I just, if you do nothing else besides stay home and wash your hands, please, please, please reach out to an elder in your life that you know, or maybe one that you don't know and should get to know. And if you are older or otherwise at risk, please reach out to other folks and just let them know how you're doing. Could be a good day, but let them know too. Get those connections going. We're going to be relying on those and building those and growing those more in days to come. So again, we're all in this together. Yes, some of us are at more risk, but we're all in this together, and that's how we're going to get through. So that's the key.
Thanks very much, Kim. Really appreciate you joining us and spending the time with us. We here at Cal Matters are focused on the story, as of course are you, and is everybody these days. But we know how important your time is to working on this problem. I do want to encourage everybody to check out our coverage at calmatters.org/coronavirus. Sign up for our newsletter if you don't get it, so that we can keep you informed of what's going on. And in a quick shameless moment here, we are a nonprofit. Some people are in a position to support us. Some people, of course, are not. If you are able to support the work we're doing, if you visit calmatters.org/donate, that would be a great way to help us out. Otherwise, we're going to do this at least once a week, so stay tuned, and we will get notices out through our email and through the newsletters. Again, Judy, Ana, thank you, and Kim, thanks so much for taking the time with us today.
Thank you all. Be well.
Thanks, you too. Bye, everybody.